afternoon. My name is Catherine Wisniewski, and I'm the Community Impact Director at the American Heart Association in Idaho. The American Heart Association and Cambia Health Foundation, the corporate foundation funded in part by Regions Health Plans, serving members throughout the Northwest, Utah, and Idaho, have joined forces with this goal to improve overall heart and physical health for women and their families in our communities. A couple of housekeeping items before we begin today. The discussion is a webinar format, but we want it to be interactive. Even though we can't see you, we want to hear from you throughout the discussion. Please put your questions or comments in the chat box. Make sure to choose everyone from the drop-down menu. It's now my pleasure to introduce our moderator for today's discussion. Mark Gressick is president of Regions Blue Shield of Idaho. In this capacity, Mark brings broad and deep health insurance expertise and is responsible for directing statewide operations and optimizing market performance while representing and promoting Regions in business and civic arenas throughout the state. Thank you, Mark, Regions Blue Shield of Idaho, and the Cambia Health Foundation for your support of heart health.
Hey, thank you, Catherine. Good afternoon, everyone. And thank you for joining us at our youth mental health discussion in collaboration with the American Heart Association. Today is our second event in a series of maternal health focused community conversations. Through our work with the American Heart Association, we are committed to increase heart health awareness for all women and their families, including their children. We hope to see you at future conversations. Poor mental well-being among children and youth is a critical problem that, if neglected, can lead to serious health complications like heart disease for all those involved. According to the National Alliance on Mental Health, 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year, and suicide is the second leading cause of death among people aged 10 to 14. Today, we will look at what the correlation is between mental health and whole person health among children and adolescents. What can we do as parents and caregivers to help? What systems are in place in our communities? To answer those questions and more, allow me to briefly introduce our panelists who have extensive experience in working with children and young adults in both physical and mental health. You can read their full bios in our chat. First, let me introduce Jason Shanks. He has 15 years of experience working as a professional in the private mental health field, as well as a counselor and assistant principal. Currently, he is the counseling supervisor for the Boise School District, leading, advocating, and supporting more than 70 counselors. Dr. Megan L. Smith is an adolescent and school health specialist with over 15 years experience as a practitioner and a researcher. Her research blends education, human development, and public health in order to support the best possible outcomes for young people in their communities. Dr. Noreen Womack works in St. Luke's Children's Mobile Care Clinic. Her main goal is to help St. Luke's reach children that are undergoing difficult circumstances and provide them with the quality, trauma-informed care they deserve. And last but not least, Dr. Alex Zamora offers more than a decade of experience in education. Beginning as a school counselor, then school social worker, and now an administrator, he has worked in both brick and mortar and virtual settings, and has served numerous years as a community college and graduate program professor. Thank you for each of our panelists for joining us today. We have a few questions prepared that will help start, but I want to encourage the audience to please feel free to drop any questions or comments that you may have in the chat. We hope for this to be an interactive discussion between you and our panelists. So now let's get started. Our first question goes to Megan. What does Idaho data say about the mental health issues for you? What does Idaho data say about how mental health issues for youth have changed over time?
Hey, welcome. I'm so glad to be here today. And don't worry, we can talk about my mental health later.
I know. I was like, what a slip up, right?
The picture for Idaho youth is not great from the data that we do have, and I will say we don't have a very full picture, but if you look across data sources like NAMI, which is the National Alliance of Mental Health, or Kid Counts data, or America's Health Rankings, we are typically in the bottom. In fact, in America's Health Rankings, Idaho for youth suicide completion is rated 46th of 50 states, which is not great. NAMI says that 52.5% of our youth last year who needed care did not receive clinical care. And Kid Counts data puts our 2022 data that they collected as our depression rates increasing for Idaho youth under 18. If we look at something like the Youth Risk Behavior Survey, which tracks both mental and physical health over time, in the last 10 years, unfortunately, suicide attempts, suicide ideation, so thinking about suicide, and depression have all increased over the last 10 years in a significant way. And so these are things that unfortunately feel very overwhelming. What I always talk about is the data that we need also, in addition to this, in addition to just these statistics, is we need to think about the risk and protective factors, the things that impact, so that we can actually make a difference. Right now, all we have is the crisis data at the end. And what we really should be collecting is things that help us solve the problem.
Yeah, I like that. Noreen, can you touch more on the subject between kind of that, what can we do more, the link between mental health and physical health? Because you're right there kind of, seeing children right in that mobile healthcare clinic.
Yeah, super good question. In fact, it's a similar question of why is the American Heart Association doing a panel on youth mental health? Yeah. When you think about it, what does heart disease in adults have to do with youth mental health? And the answer that we've really, research has really shown is that it has everything to do with each other. So physical and mental health are basically two sides of the same coin, and you can't have one without the other. And again, over the last, I'd say a couple of decades, studies have shown without a doubt, really, that struggles in childhood can cause rewiring of your brain cells and their connections, and cause actual structural changes to your brain. It can change how your genes are expressed. It can cause pretty dramatic hormonal changes too. So childhood difficulties have been shown to be a direct cause in at least half of the top 10 leading causes of death in the United States, including our #1 killer, which is heart disease. So if we're interested in leading healthier lives and preventing heart disease, we absolutely have to look upstream and pay attention to the health of our children, both physical and mental.
Yeah, Noreen, I love the comment about looking kind of upstream for that, right? Jason, I know you're leading like 70 counselors, you're working in Boise school systems. Can you provide any comments about kind of signs or symptoms that we should be looking for in youth that could be dealing with mental health issues?
Yeah, absolutely. That's a great question. So I would say, before I list off any of them, I would say that everybody's situation is a little bit different, and their experience may be different. But if these signs are showing up over a prolonged amount of time, or they're getting in the way of daily functioning, then it would be a great indication that there might be a mental health issue going on. Some of the most common ones are changes in mood. That can be a rapid change in mood, that could be a change over time, but that student may not be acting like they've acted their whole life, or maybe not acting a month ago. Some of my other telltale signs are isolation and withdrawal. The student may be spending a lot of time in their room, or not talking to their peers that they're normally talking to, not participating in events that they normally would, sports, whatever that might be. A lot of these have to do with changes. So it could be changes in sleep patterns, it could be changes in eating, anything that might signify that there's something going on. Other things to look for would be decreases in energy, motivation to do things. If all of a sudden a student or one of our children are wanting to sleep more, or just don't have that motivation to get off the couch, they'd rather just watch TV or be scrolling on their phone, that could be a sign that maybe something's going on. Other things that come out in the schools pretty frequently is maybe irregular outbursts, maybe behaviors that we haven't seen before, maybe the inability to focus. That is a really big one that kind of rises to the top of the list within the schools. But then also that directly affects and is a good tell sign for teachers of why is this student all of a sudden not scoring as well as they used to score. That is a great avenue to start asking some questions about what is going on. The other really significant ones, if a student is saying that they are having mental health issues, that's a really good time to listen. A lot of the times as an adult, I've worked with many families that have said, no, they just say that all the time. And I said, that could be a cry for help. So really listening to that student, if they're talking about self-harm, if they are committing self-harm. And then the two last ones I really wanted to focus on, I can't even tell you last year how many students I talked to at the junior high and high school level that disclosed that they were using some sort of substance. And when I asked why they were using a substance, they said, well, it helps me cope with what's going on. And digging deeper into that, they were actually trying to medicate for possibly the mental health issue that they had going on that they weren't actually taking care of. And for them to tell me that as somewhat of a stranger was surprising to me. So that was a big one that really kind of came to my forefront recently. And then the other one that I work a lot and through the years with our nurses over is what are those physical symptoms that are coming out to the school nurse or that are presenting themselves to the counselor or the nurse that may actually be saying, hey, this is a mental health thing going on, not necessarily a physical thing, but it's manifesting in a physical way. So our headaches, our anxiety with our stomach aches, body pains, all different types of things like that are great signs to be looking for.
Hey, that's really helpful. For everyone that saw me, I know this is a really serious topic. You saw my smile on my face, and it was because when Jason was talking about certain symptoms, isolation, withdrawal, irregular outbursts, I'm like, that describes every teenager in the United States, right? And kind of thought about my own kids, right? And went, wow, right? Like, so I guess my next question would really be, and I'll open it up to any of you and all of you, is just really, how do you any advice, I guess, that you would give to parents and caregivers on how do you look for those signs? And then more importantly, how do you introduce the conversation to children around mental health? Any thoughts on that?
I'll start this, Alex. Something that Jason said, talking about in his last answer was when students kind of try to express themselves. And I often tell adults that I'm working with that the students, so I work in a school, the youth's crisis may not be my crisis. It would not be a crisis to me, but I can't minimize that experience for that individual. And so I think it's really important as adults that we recognize that and honor and respect the experience that youth is having, and start from where they're at in promoting kind of the additional conversation, the additional support that youth may be needing.
Yeah, and just another thing I'll just highlight, Jason said this, but the change. So of course, all teens sort of, sometimes can isolate, but it really is if you can notice a significant change. So if your kid is always in their room by themselves, I mean, definitely check on them anyway. But if that's a new behavior, that's a real indicator there.
Okay, that's helpful. Noreen, any comments? I think we're good. Let me, sorry, I didn't want to interrupt you.
No, go ahead.
Okay, very good. So Alex, one of the early discussions you and I had was really around data again. And it was interesting that July is Racial and Ethnic Minority Mental Health Month, and about 20% of Idaho's population now identifies as a racial ethnic minority group. What does the data say about challenges faced by people from minority communities in Idaho?
Yeah, so 20% of Idaho's population, but then we look at that 20%, and when we kind of leverage some national data around, like from Health and Human Services, the U.S. Department of Health and Human Services, some data says, depending on the group, that from 25% to 39% of individuals who have a mental health symptoms will be seeking treatment. That's compared to the majority population, the white population, at 52%. So there's a discrepancy there in which those of racial and ethnic minority groups are not seeking treatment at the same level as their white counterparts. And so as a clinician myself and as a educator, I really have to kind of challenge the idea of the why behind that and explore the ideas of cost, healthcare, access, and truly the stigma and providers. So really for me, as I wrap my brain around this, it's really this idea of access is how I would articulated is, what is it easy for individuals to access mental health supports? Are the individuals that are providing support, so the providers, have the cultural awareness and cultural humility to provide services at the level and the space and the place that the individuals may need? And is there availability? If we look at I work in a rural community, is there just the availability of resources there? Certainly, many things occurred since COVID, including influx of telehealth. But when we look at rural communities where internet access may not be as readily available, we look at communities of poverty in which, sure, maybe I have a phone that I can connect to telehealth support, but I may not have the space to be able to have a private conversation with somebody else because I am surrounded by my family and those around me. And then clearly just financial issues. And so we can look at just kind of the data around social economic experiences for those in marginalized groups, and kind of layer in some of those components. And so I know Noreen commented about this idea of upstream supports, and I really, as a school, I reflect on that and think about what can we do, and that we leverage our school counselors internally, we leverage partnerships with other providers to come into our communities to meet the students and their families where they're at. But certainly it's a very comprehensive approach that's needed to address a very complex issue.
Listen, I totally agree. Your comments really resonated with me related to whether it's healthcare access, the number of counselors, the number of therapists that are out there. And then strikingly enough, just in rural areas, that impact on broadband. If you can't actually have a physical presence, then how do you actually create kind of broadband and use virtual care to actually access care and close kind of care gaps? So I thought it was really pointed. Out of curiosity for Noreen, you're in that kind of that school setting, so to speak, through the St. Luke's kind of mobile care clinic. Of all the things that Alex just mentioned in terms of access care, he also mentioned kind of stigma. Are you seeing where children are actually willing to kind of access care, or is there still more of an issue around awareness and reducing stigma?
So short answer is there's still, the whole point of St. Luke's Mobile Clinic going out to the schools is to try to decrease, as many barriers as we can for children to access services, both physical and mental health. And even going to the school, so you're eliminating that transportation barrier and you're right there, and the teacher is encouraging the family. Sometimes there's still plenty of barriers between me and the child. Sometimes I feel like I need to go to the house and just myself, and sometimes it's not anything that we can do. Sometimes it is, to Alex's point, cultural. There's still unfortunately taboo around mental health, to the point where, even if a child might want to access it, what is my father going to think if I go to this doctor? What is my grandmother going to think? And so that's, we do have to approach that with, like Alex said, humility, because we need to be telling these parents, hey, it's okay. We need to be talking about this. And, to one of your questions earlier, how do we broach the subject? Well, we talk about our own, right? We have to destigmatize it by starting with ourselves. So let's start with Megan's mental health. Just kidding. So parents should be saying to their kids every day, this was the day I had, and it was a great day, so I felt really good, and so I feel like making dinner tonight. And then if they have a bad day, I had such a bad day, I feel this is what I'm feeling, and it makes me want to, do this, or it makes me want to say a bad word, but I'm not going to, because I know that's not going to be helpful, but I'm going to do this because it's going to help me. And the more they hear that from us, just like the conversations about healthy food, all of the different ways we want them to be healthy, we need to be having these conversations about our own mental health.
Yeah, no, that's a really great point, and I appreciate the humor here related to Megan's mental health. That was my bad, but we can talk about my mental health later on. How's that? I just want to pause right now and just encourage everyone, if they do have questions, to put them into chat. We do have our first one. So one of the questions that was asked in chat here is: so many of Idaho's youth are struggling, or we're kind of highlighting that, yet there are so few clinicians and counselors available to help. Are we doing enough to try to overcome the mismatch between the supply and demand of experts like you?
So I'm just going to jump right in here because this is a question I get a lot. So the work that I do with my organization, Communities for Youth, throughout the state, this question, of course, comes up everywhere we go, right? How do we get more mental health care providers? And certainly that is an issue we should continue to try to address in Idaho. But I would like to recommend, and it's come up a few times in our conversation thus far, is going upstream. So we need to actually be turning off the tap so that we don't need so many mental health care professionals bailing it out, right? We need to go up and think about what are the types of communities and environments that are more likely to promote good mental health for young people, right? And the good news about this is, despite this really overwhelming, hard topic, right? This is an issue that we all face at some level, either in our own families or families nearby us, is that upstream prevention is something that anybody can participate in, right? You don't have to be a mental health care provider. You don't even need to know much about mental health. Noreen gave us some great examples of how parents can be talking through their feelings, and that is an upstream prevention approach. The more young people who grow up in families where feelings are discussed and sort of reactions and consequences are discussed, the better we are. But really, each community in Idaho can sort of own this prevention space. When we surveyed around Idaho, we found that young people really struggled with high levels of stress and high levels of social isolation. So loneliness. So those two things were the main drivers of depression in our state. And if you think about that, it might feel like, oh gosh, that's hard. Loneliness and stress, those are hard things to think about. But really, we know that if we just connect people together in our communities and do a better job of really developing those strong, deep, tight relationships, we can do a host of good in this depression. So absolutely, mental health care providers are important, and we need to continue working on how to bolster and encourage that. But I would say we can't just wait for all the mental health care providers to show up, right? And again, the good news is that our communities and each person in that community can actually help work right now. We could start today, right?
So if only you were passionate about the subject, Megan, do you know, I mean, just right off there, which was great. I'm kind of curious on when we think about upstream activities that we can do, and then the commentary around stress and isolation. And I'll be honest with you, like I think about that all the time, because you can see youth just, and adults, but just walking around all day long with their face glued to their phone, and they're connecting, right? You think they're having conversations, they're doing things that they wouldn't feel isolated, but it is one of the top two things that you mentioned between stress and isolation. And then that whole kind of building a community that's connected together, everyone for the group. I mean, is there just any specific things that you can think of that we would prioritize as a state? There's literally no, there isn't that same sense of passion. I'm just kidding. I knew I threw you guys kind of a curveball, but I'm just kind of curious in terms of what we could do. I see that Noreen took herself off.
Thank you for that question. So again, I am all about upstream prevention. We know there's a lot of hurting families out there, especially in our rural communities. I think from a statewide prevention perspective, one of the things that we could really do that would be really even just financially smart would be to invest in early learning and preschool. That way we're catching these families with their kids early if they're struggling, either again physically or mentally, or even just with supports that they need, transportation, food, housing. We can identify those families early. We can help intervene if they need maybe some parent coaching, we can get right there, because it's really, I think that one of the family's main supporters, other than medical providers, is educators. So if you get an educator who has just a lot of knowledge around emotional intelligence and all of those sorts of things that that all I need to know I learned in kindergarten kind of stuff, you get those kind of educators connected with that family. Hey, it looks like your Johnny is struggling with this. Why don't you try this? And then really, if they do need more support, either mental health or like any kind of counseling, or even just some speech therapy, occupational therapy, they can plug them in when they're 3 instead of 13. That's what would make the biggest difference. So I think from a state perspective, spending more time thinking about and investing in early learning would be a good bang for our buck.
Oh, that's great. There's questions in the chat, but I want to kind of follow up on this stream of discussion around kind of early learning, kind of prevention. At what point, any advice or discussion around at what point should someone seek professional help for children's mental health? Like when should a parent or a caregiver kind of really engage?
I would refer back kind of to what I spoke to before. If you see a student or your child and their mental health, quote unquote, is getting in the way of their everyday living, if something is coming up where they're not living to the way they used to, or even in talking to a family that maybe is your friend, and you're seeing a significant difference where same age peers are acting, and one may be considered typical, and one, once you're realizing it's like, wow, my son or daughter doesn't act like that at all, that could be a good indication like there might be something going on there, and that might be a good time to at least start having that conversation. Typically, if it's the parent reaching out, I would want that parent then to be contacting the school, see if they're seeing the same thing. Maybe it's just a home thing, maybe they're seeing the same thing at school. That's a great indication of what's happening in the other part of their day. So just starting that conversation with different people and different avenues that young person might be participating in.
Yeah, that's a really great point, because I think a lot of times parents or caregivers may think they need to go it alone or wait until there's a plethora of evidence, right? The reality is just simply go reach out, access the services that are available. There's so many individuals that are interacting with the child in question, right? That they can actually help give you a perspective and an opportunity. And obviously, I think it's better to think about intervening earlier rather than later, right? It's important for the health of the child. So one of the questions was, when I got onto cell phone usage, along the topic of cell phone usage and being mobile, what are your thoughts on social media bans for minors or young children? Is that a solution that could help? Or is there a correlation between mental health issues and early social media usage? This could be a hot button. No, go ahead, Megan.
Oh, I was just going to say, so social media use is interesting because it is more a symptom than a cause. And the research, I will tell you, unfortunately, as much as people want it to be black and white on this so far, because it's a newer area, is mixed, to be honest. So if you are someone, for instance, living in a community where who you feel you are is not really validated or mirrored for you anywhere in your community, and you find ways to access that community online, it can be a positive thing. However, I think, my partners and I, my colleagues and I, we talk about social media as junk food of relationships, right? So just in the same way that you might feel hungry and you might run through a McDonald's to grab a burger because you're trying to satiate your hunger, social media contact and interaction is the same. It's junk food. And I think we need to talk about that with our young people, because they do feel like they're doing something social, right? And all of us do, adults too. It's a social activity. So people, I hear this all the time, oh, we're the most connected we've ever been, right? But it's like, we're the most satiated we've ever been. Now we have all these McDonald's we can eat at, right? And so I think it's important to think about that and to discuss that. So there are ways to have deep connected relationships on social media, but by and large, we're having junk food connection. And that's why we have so much loneliness, both at the youth and the adult level, despite all the connection that we find in the social media realm.
And if I may, I would just add, I think when we start talking about social media and we just start talking about technology, right? We have AI and, what is that going to do as we move forward? So I think we as the adults, when in whatever setting we're in, is important for us to really focus on that executive functioning of the youth. How does one critically evaluate the information that's being presented to us? How do we digest the junk food that is being presented to us in social media or any of these streams of technology? And so just from a practical standpoint, I think those are the conversations that we really need to have. Is just because I see it on my screen doesn't mean it's always true. Or what lens do I need to look at things to make sure that I'm just being thoughtful of how I process the information being presented.
I want to agree with both Megan and Alex, and add that it depends on the age. The age of the child. There's now been enough research around it where we know, for instance, under 3 years of age, it's just not the same. They don't learn from screens. When it comes to preteens, there are definitely things out there that obviously they should not be looking at. And so in a general way, I am for age limits. There should be age limits, but how to go about enforcing them is very tricky, because then it gets into information that you have to share as the user, that you have to put out on the internet, and then who's going to use that information. So it's very complicated, but the short answer is absolutely there need to be limits. And as parents, we need to go first, and as adults, meaning, we need to be responsible with what we're, just like what you put in your body, what you're putting in your mind is just as important. And maybe we're telling the child, you can't do that for 8 hours, but maybe we are. I've caught myself doing that actually. So I know it happens. So, but anyway, yeah, that's.
Yeah, I think those are really great points. I was taking some notes, and I'll be honest with you, I think the commentary around the symptom or the cause, really, it just kind of felt right to me, because a lot of times we're quick to blame one thing versus the other, and the reality it's a function of both. The analogy, by the way, of junk food, just that resonated right away, because I was like, it's so true. Like, you can either decide to eat healthy or choose to eat unhealthy. Same thing. You can be on a screen and choose to go down a path of, getting information, enlightening, true, meaningful conversations with friends, etc. Or you can go down that doom loop and just scroll forever, right, on one bad thing or another. Unless, of course, there's anyone in the audience that likes those cat memes, and that's just generally positive. I'm not saying I'm one of them. I'm just saying you might like them. All right, that's all I'm going to say. There's another question that we've got, which I think was really kind of on point with some of the conversations that we've had, which is and I'll just read it verbatim. You've all offered some great insights on what the problems are, what symptoms to look for, and what can be done upstream to head off problems before they worsen. But do we have a sense of why this problem seems to be growing in Idaho?
I'm waiting for that.
Yeah, you're unfortunately the person that took themselves off mute, so you got to go.
Jump in. Okay, so this is a question that also comes up a lot. People want to know, why is our mental health situation, particularly at the youth level, increasing, particularly in Idaho? And one thing I like to say is that even though it is increasing in Idaho, it is also increasing nationally at this level. And so, in fact, the US Surgeon General has declared youth mental health the epidemic we're facing as a nation at this age group. And so I just want to say that it's not just Idaho, right? We have been facing mental health concerns, and they are increasing, but the nation at this level is also increasing. And so I do think that's a bigger conversation. And I'll just plug again that we need to think about what are the actual things, and we need to find out from young people, because we can take a bunch of guesses, but we don't know. until we talk to young people, what are the things that are linking to depression and feelings of suicidal ideation? What are the things that are linking to high levels of stress for young people? What are the things that are linking to high levels of loneliness? And we have some ideas at the national level, but we don't really have the data to know that at the state level. And so when people ask me this question, I say, well, we have some indications based on small surveys and communities we've worked in, but we don't really know at the state level. And so this is something that I think we do need to sort of, as a community, as clearly someone interested in the topic, that we need to ask our state leaders to do for us, is to help us figure out what's going on in the state for young people.
Yeah, that's a great comment. Out of curiosity, because I've always kind of balanced in that healthcare space, we have seen this kind of like, at one point I was calling it pent up demand, right? Where it was, you reduce the stigma, you increase the availability, you made it easier to get, lower cost, right? And all of a sudden you saw this demand just go through the roof, right? I mean, it was honestly a 45-degree kind of angle in terms of just the usage, and you couldn't almost meet up the supply with the demand. And part of it was kind of it was pent up demand, right? It was always there. Now we got it. Then we reduced kind of the stigma. And then you can kind of add on a little bit of whether, post-COVID interactions, we go into isolation. So I guess I'm kind of asking a pretty open-ended question, which is just, do you think it's kind of a function of both, where it's a little bit of pent-up demand and these new issues? Is it a new pandemic, or is it really kind of like it was something that was always there, and we've just kind of now been going through a process of kind of surfacing it up and making people aware of it?
I think, Mark, you answered your own question. I think it is a little bit of, yeah, it is both. Because people say, why do I even, because when they ask me, should I seek some help for my child who's struggling? And I always tell people, if you ask the question, then the answer is probably yes. And then they say, well, why would I? Because I already know from my friend that she can't get help for her child, and this other friend, when I'm asking where they go, but their practice is closed. And I said, well, if you don't ever say anything, then we'll never know what the demand is. So if you go out there and seek that help, even if it's difficult, then at least we know, oh my gosh, there's a problem. There are a lot of people looking for this type of help and they can't find it, and that will start the process of getting an understanding of what the numbers are so that we can respond and react.
Yeah, that's fair. I will fully recognize that answering my own question makes me a terrible moderator. All right, so this may be the last time I'm ever moderating, but hopefully all of you kind of just take a little pity on me and just kind of keep working through me. But okay, I have a couple other questions that I want to kind of dovetail a little bit. We've kind of talked about prior that there was like stress and isolation, right? And a lot of the conversation has moved into that kind of space around social media isolation, that kind of stuff. I want to pivot a little bit back to stress. And one of the questions that I had here was kind of like, what can we do to help youth who are dealing with kind of chronic stress? Is it the same kind of resources, or are there different kind of strategies or resources that we should consider?
I'll speak here in a global way for a minute, and then if someone wants to chime in, that's great too. I think with the chronic stress, again, a lot of it comes back to just talking with that student, acknowledging that you see them experiencing stress, or that they are communicating with you that they are under a great deal of stress. And in that discussion, as an adult, whether as a parent or educator, doing a couple things. Identifying what some of those things are that are creating that stress, discuss it, and see if that can be changed at all. Sometimes I think we forget that youth are youth and may need some direction. Do they need help prioritizing that stress, or prioritizing tasks that could alleviate some of that stress that there is? The other thing, going back to what Dr. Womack said, is modeling then how do we deal with it? What's a healthy way to deal with that stress, and what is a healthy way not to deal with that stress? If I drink 3 energy drinks or alcohol to deal with that stress, that's just going to get me going further down that spiral that's going to create even more stress. But if I am getting adequate sleep, if I'm exercising and each day I'm Meeting that stress with an optimal self, I'm probably going to slowly get myself out of that stress theoretically. Obviously, there is a point where there may need to be intervention from a therapist or something else if that stress is chronic enough, but there definitely are things that we can do to alleviate some of it or combat some of it.
Okay. Any other add-on comments? Oh, go ahead, Noreen.
I 100% agree. You know, parents are their children's best teachers, and you know they're not going to listen to what you say when your actions speak too loudly. And you know, I see this every day. I work when I see kids with you know, behaviors in school, and so they come to me, and you just have to sit in the room for 10-15 minutes to know that you know that parents is struggling too. And so I think one of the best ways to help children with their stress is to, again, I already said this, but to model it, right? So the big buzzword right now is self-care. And so there's also a lot of misconception about self-care. People think it's selfish care, but it really is all about putting your own oxygen mask on first before you help your child. And so you not, you know, and self-care is not having a donut, you know, for breakfast. It's taking care of yourself both physically and mentally in the long run, right? So that's what we need to be talking to our families about. Sometimes when I meet with a student and a family, that's all I talk about. Okay, what are you doing, mom? You know, are you getting enough sleep? You know, did you guys have dinner together last night? Did you guys sit and, you know, read a bedtime book together? Did you what have you done for yourself, just yourself, in the last 2 weeks, being a single mom working, you know, with 3 kids, you know? And a lot of times they'll say, oh, nothing. It's like, well, let's talk about that first. And I think that's where a lot of us, including myself, need to start.
Yeah, that's a great point. I had a joke about me and reducing my number of Americanos as one example of modeling the right behavior. But Noreen, your example about a single mom and trying to kind of carve out that day, that time during a day to actually just kind of model out the right behavior. And so, you know, I'm kind of hearing a lot around kind of being open and being willing to discuss how you deal with the stress that we have, and then lastly, kind of the modeling of your own behavior. That kind of self-care component is really critical for youth to kind of see us engaging in as well too. So overall, great points. Megan, you raised your hand, so I'm assuming.
Sorry, I can't help it.
Perfect.
I know I'm like a broken record, but this is a great example of, especially the single mom example, of someone who maybe can't even fathom how they would carve out an hour for themselves, right? And this is why it's so important to work at that community level, because we can create 2 single moms, for instance, can help each other out by creating space for one another, right? I'll take the kids for an hour on Thursday. You can take the kids for an hour on Friday. Makes that hour that you're watching all the kids a little bit wilder, right? But also gives that person the time they need. And that's where these connections that unfortunately we've lost across many of our communities, not just in Idaho, but in the nation, really can help us. So I think part of the thing that community leaders can do, both informal and formal, faith leaders, school leaders, et cetera, is helping to carve out that space and to talk about how do we support each other in needing this? Because I think we get a lot of messages like, well, just take time for yourself, or stop being stressed yourself. And that, at least to me in some moments as a mom, and a busy mom at that, can feel like another thing I'm not doing well, right? And we do really need other humans to help us and to support us. And so I think hearing that message can also help, and thinking about, okay, who could I offer support to that then could also offer support to me? Or how can I, if I do have time and resources, think about the family in my neighborhood who may benefit from an hour of me just taking the kids over at my house? And those are the things that really, this is why I think we can be successful in Idaho, because these are Idaho things to do. Like if we think about back in the frontier days, like we didn't build the barn by ourselves. We built it in community. And I think this is like Idahoans know how to do this. We just need to come back to it.
Yeah, yeah. You know what? That's just a great point, because I think you tied in a lot. When Noreen made the comment about the single mom, it resonated with me because I was raised by a single mom, and I was thinking about the complexity of all that. And then then Megan just threw out the, single mom getting along with another single mom and connecting it. I'm like, it's a simple solution, and sometimes we overthink it. And a lot of times the best ways to solve some problems is just exactly what, the community is made up of, right? So like in the DNA, how do we kind of accelerate that and get people kind of together? And so community engagement was another one that I wrote down as ways to understand how we can do it. Clearly that was unplanned, as you could see Megan's reaction. So I'm trying to get my rating as a moderator from the F to like a C, maybe a B. All right, so stay with me. I know we're running out of time, so I have one final question for all of our panelists. Okay, from your professional perspective as either a doctor, counselor, administrator, researcher, what is the one thing that you hope families and caregivers take away from this session? I'll start with Jason, you first.
Yeah, I would say there's hope. There's hope with our youth. There's hope in connecting them to their schools, connecting them to their communities, their churches, to other families around them. And with those connections can come great things. So don't give up on kids. If anything, we need to support them. And I truly believe we're going to get through, if we want to call it a pandemic, get through this pandemic, but there's definitely hope.
Excellent. Okay, Megan.
That was spoken really well. I appreciate the hope message, because I think it can become so overwhelming that we sort of turn it off and look away and are like, well, I'm not going to really deal with that. It's too big for me. And so I'll just add to that I really do think that community piece can be important, and it can feel also overwhelming as an individual who's busy to create community. So I loved, I think it was Alex's suggestion earlier, just to reach out to the school or Noreen, like for any reason, like, gosh, I'm wondering about my kid, or are there events that my kid could be participating in through the school, right? Just finding ways to connect. And then it can also be as simple as, knocking on your neighbor's door. I know that sounds wild these days, but it used to be a normal thing, and saying, hey, maybe we could share forces for dinner tomorrow night and just get to know each other. So those are the kinds of things that I think that Idaho families are definitely capable of, and parents, and thinking intentionally about how do I put the junk food screen down and create real connection around me and my kids.
Excellent. I appreciate that. Alex.
For me, what I like to tell the adults working with the youth or just living with their own kiddos is to seek to understand what the situation is for their youth, for their kids, seek to understand what resources may be available, to the comments that I've already shared, but really just to address things with a sense of curiosity. We have to recognize that the youth that we're supporting, whether they're our own kids or in our professional roles, don't have the 30-some years of experience that I have individually, that they're trying to figure out, the things that I figured out a couple decades ago. And so it's okay to ask and to seek to understand, so that our youth know that it's okay to have those conversations, and sometimes it's okay to just be vulnerable and share.
Excellent. Noreen.
What I always share, because it's the absolute truth, is that you are already doing a good job with the kids in your life. You really, really are. It doesn't matter that you're struggling as a family. It doesn't matter if your child is struggling with either physical or mental health issues. We've all won the Parent of the Year award more than once.
Yeah.
But if your intentions are there over the long run, your kids know that. They just do. And so just, keep up the good work and just keep trying, because you're halfway there with the awesome job that you're doing.
Yeah, That's really great feedback from all four of you. I think Noreen's last comment was actually quite profound. I think everyone is just so hard on themselves, and especially if you're a parent or a caregiver, I think we just amplify it even more. You know, we try to shoot for perfection, and a lot of times, and I'm going to channel the rest of the feedback. A lot of times, we are doing all the right things that we possibly can be doing. You know, showing that curiosity, kind of the seeking to understand what's available, what options are there, how do you connect into schools to learn more about it. There's just all these different resources that we can have. And then that sense of community that then kind of also then leads to kind of that hope. I like it. You know, I think this is a problem that we're all looking to address. I think we've made really great strides over the last couple of years, both addressing those issues around affordability, access, broadband access, so we can get to rural areas as well too. And I actually do have a lot of hope that we're going to continue kind of moving down that right path in terms of making sure that we can solve this and address these issues as best as possible. So I want to thank Jason, Megan, Alex, and Noreen for your time today. You guys did a really great job. I, as a moderator, did not, but you were stellar. So thank you. Now I'm going to turn it over to Catherine so she can close us out.
Thank you. And thank you again to Cambia Health Foundation for sponsoring this wonderful event. A recording of this webinar will be emailed to all participants along with any of the resources that were discussed. Please visit heart.org for additional information and resources.